Do you frequently feel like your heart is pounding, or your leg suddenly swells and hurts for no reason? Or maybe someone in your family had a blood clot at a young age. If yes, you might want to hear about a hidden health condition called antithrombin 3 deficiency. Imagine your body is like a car. Blood clots are like brakes. They help stop bleeding when you're hurt. But what if the brakes are too strong and get stuck? That's what happens here. Your body forms clots too easily, even when not needed, because it's missing a natural brake release protein called antithrombin 3. Without enough of it, clots can form in legs, lungs, and even brain, quietly and dangerously. So what causes this missing brake release? Most of the time, it's passed down from parents, like inheriting your mom's eye color or your dad's nose shape. This is called hereditary deficiency. If one parent has it, you have a 50% chance to get it. Think of it like a typo in a recipe book, your genes, that gets copied to the next generation. This typo makes your liver produce less or faulty antithrombin 3. But sometimes, people develop it later in life due to other conditions, like severe liver disease, kidney problems, or even during pregnancy or after major surgery. This type is called acquired deficiency. So ask yourself, do blood clots run in your family, or have you had unusual clots during pregnancy or after a hospital stay? These could be clues. Now here's the tricky part. Many people with this condition don't feel anything until suddenly they do. Picture this: you take a long flight, sit still for hours, and then your leg swells up, turns red, and hurts. That could be a deep vein clot DVT. Or worse, you feel short of breath, chest pain when breathing deeply. That might be a clot in the lung pulmonary embolism. These are common signs. Some women notice issues during pregnancy, like clots or repeated miscarriages. Others get clots after minor injuries or surgeries. But remember, some people feel fine for years. That's why it's often called a silent danger. If you or your family have had unexplained clots before age 50, it's worth asking your doctor. Could this be genetic? How do doctors find out? They don't guess, they test. If you've had a clot and it's unusual, like happening at a young age or without a clear reason, your doctor might order a blood test to check your antithrombin 3 level and activity. It's like checking the oil level in your car. Low oil means your engine, or in this case, your blood, might overheat and clot. Testing is best done after the clot event and not during heparin treatment, because heparin can give a false result. If the test confirms deficiency, treatment often means using blood thinners like heparin or warfarin, especially during high-risk times like surgery, pregnancy, or long flights. For example, if you're flying overseas, your doctor might prescribe a shot before the trip to keep your blood flowing safely. Long-term, some people need daily medication. The goal: keep the brakes working, not too fast, not too slow. Can you stop this from hurting you? Yes, by being proactive. Think of prevention like wearing a seatbelt. It doesn't stop the accident, but it saves you if one happens. If you know you have this condition, avoid long sitting, stay hydrated, and move your legs during travel. Talk to your doctor before surgeries, pregnancy, or hormonal treatments like birth control pills. These increase clot risk. Smoking, quit. It worsens the danger. Family planning, consider genetic counseling. You can help your kids be tested early. Simple steps, big protection. Ask yourself, what risks am I ignoring today that I could fix tomorrow? Science never stops. Recent studies are exploring better ways to detect and treat this condition. Researchers are working on gene testing that can find the exact typo in your DNA, helping families know their risk earlier. Newer blood thinners like rivaroxaban or apixaban are being studied for people with inherited clotting disorders. They are easier to take, no regular blood tests, and might be safer. Some labs are even growing antithrombin 3 in labs for replacement therapy, like giving missing insulin to diabetics. One cool advance, point-of-care tests that give results in minutes, not days. Imagine a future where a quick finger prick at your doctor's office tells you your clot risk instantly. That future might be closer than you think.